now in the country.
State health experts tracking the spread have seen clusters of cases in certain settings more than others. Infectious disease experts say behavior plays into it, and there are ways that people can work at being safer. News 8's Lisa Carberg has more on what they are seeing. Lisa.
Darren, it's been a very tough balancing act for certain places like restaurants, which have spent so much money to take precautions in order to stay open and afloat. One infectious disease expert knows how tired people are becoming and how key it is to do your part if you have to go somewhere.
Connecticut's Department of Public Health has a team that traces COVID-19 clusters. Its most recent report from December revealed that restaurants and workplaces topped the number of clusters. Then home and child care facilities were shown to have cases. Experts looked at data studying what kind of behaviors in places are most dangerous in spreading the COVID virus.
So, for example, social gatherings, we've seen potlucks that led to 27 positives. We've seen a number of incidents, birthday party, retirement parties.
Grant says restaurants have put so much into trying to keep their atmosphere safe, but the majority of spread in them is with people who eat inside and when people keep their masks off.
Try to keep in mind that your primary means of protection is, especially when it's not people within your household that you're having lunch or dinner, you're meeting in a restaurant with, try to ensure that you're putting your mask back on as soon as possible.
He says if you are not eating or drinking, you should have your mask on. As for spread in the workplace, Grant says not only have they learned a lot, but compliance standards are very high for proper protective equipment. He knows that people are very fatigued and expects more post-holiday spikes with infections.
I think we will see a fallout from the Christmas and New Year's celebrations. I'm hoping people kept that to a very minimum, but we'll see that data. But it's really not surprising.
After Thanksgiving, he says we saw a significant uptick.
If you look at healthcare capacity and capability, it's going to be challenged over the next few weeks, next few months.
And some other locations reported, but with lower numbers, were in places of worship, sports facilities, adult congregate living, and from domestic travel. Lisa Carberg, News